This is Mr. Gilbo. Mr. Gilbo is a good friend and a patient of ours, 83-year-old gentleman. What we've got here is a leg that has been affected by a combination of severe chronic venous insufficiency and arterial insufficiency. The important thing here is in a lot of our elderly patients, we forget that they can have a combination of both. And in the chronic venous insufficiency ulcers that don't heal properly with traditional treatment, we always have to think that there's something else underlying. And in his case, it was arterial insufficiency along with CVI. So what we've done is some work to improve his arterial flow, and now we're in the process of really trying to get the large venous insufficiency ulcer, as you can see right here, healed up. Now we've done several things. First of all, we have used several weeks period of time in which we have used standard dressing changes. This problem has been going on for decades with Mr. Gilbo. He's had several weeks of the Dermacyn treatment prior to our second treatment, which was an appligraft. We placed an appligraft approximately 6 weeks ago. The advantage of the Dermacyn in that instance was that it cleaned this wound significantly faster than normal. He really had a lot of infection around this. It cleaned it up quite nicely. It allowed us to then place the appligraft much quicker than normal. We did not have to use significant oral antibiotics, and really this antiseptic killed the bacteria, got his chronic venous insufficiency ulcer to a stage where the appligraft was placed. Now you can see the wound is very nice and in red. You can see granulation tissue certainly is significantly increased. This wound was twice this size in the past. So we're in the midst right now of the healing process. In our experience, we've certainly applied Dermacyn in several ways. Everything from direct pouring on the wound to changing with gauze, much like a wet to dry dressing. And also we have applied it by spray. And all of these ways actually work. We're going to place it in this spray bottle and it'll be a little easier to apply. Now you don't have diabetes, do you?
No, sir.
No. So this is a non-diabetic type of classic chronic venous insufficiency plus arterial insufficiency wound. We've kept this relatively infection-free, again, using the Dermacyn through the weeks, and we're going to apply some right now, basically just by pouring on the 4x4 to begin with. I'm also going to just let a little bit run down.
Don't waste it.
We won't waste it.
If it's that good, don't waste it.
No, it actually kills all bacteria, viruses, spores, about anything could get on that wound. It kills very rapidly by contact. This is a superoxidized water that, again, we've been getting excellent results with. We found it to be very safe. We send our patients home with it. The other things that we have experienced is what the patients don't experience. That means they don't seem to have complications, irritations, any type of real cellulitis or sensitivity, and naturally that can certainly happen with betadine. Dr. De La Pola's work has shown almost 20% of those patients that he treated with betadine had a severe reaction, and that's one of the real side effects and difficulties with betadine, and one of the advantages of the Dermacyn. Not a whole lot going on as far as any type of foaming or anything like that. This is not hydrogen peroxide, certainly much better, and part of the mechanism of action here is that it will kill only the important cells and not the human tissue. In other words, it will kill only the bacteria, virus, etc., and not human cellular tissue.